Hi everyone. So just in terms of where we're at with our vaccination program, it's something we're really heavily focused on at the moment. As I mentioned earlier in the week, across the Golden Valley area local public health unit, so that's really from Kilmore right up through to Mansfield and across to Benalla and Cobram and of course the Golden Valley area, 39% of people who are aged 18 and over have had their third dose vaccination, and only 40% of children aged 5 to 11 have had their initial dose, their first vaccination dose against COVID-19. And those numbers are really quite low in terms of where we'd like to be. We're really wanting people to come forward who haven't had the opportunity to be vaccinated yet for their third dose to do so as quickly as possible. And it's really important in terms of providing that level of protection against contracting certainly the Omicron variant, but COVID overall, and reducing the chance, if you do unfortunately contract COVID, of becoming quite unwell. So in response to that, over this coming weekend we are increasing our vaccination clinic availability. So this Saturday and Sunday we'll be running vaccination clinic pop-ups at the St George's Road Primary School. That's 120 St George's Road Primary School, and that pop-up site is for children 5 to 11 year old, and also adults who are able to access their third dose vaccination as well. We'll also be opening at the Macintosh Centre as well across the course of this weekend, so plenty of access to opportunities for people to get that third dose vaccination or first dose vaccination. And of course in the last few hours or 12 hours or so, we've heard of the children aged 16 and over now being eligible for their third dose vaccination 4 months following their second dose. So all of that information is on our Facebook page, the GV Health Facebook page. So to be able to find out when and where you can access vaccination, please check that page. You can book at the coronavirus.vic.gov.au website or call 1800 675 398. But during the course of the coming few days, and certainly at that pop-up clinic at St George's Road this weekend, people will be able to walk in and get their vaccination. So if you want the certainty of having an appointment booked, please do so by all means, but also if you want the convenience of being able to turn up without having made an appointment, that option's there as well. So vaccination is a really important thing for us going forward. In terms of where we're placed with cases at the moment, 387 cases across our local public health unit in the last 24 hours. 175 of those were in Shepparton, and just under 2,400 cases across the local public health unit for GV Health, and 936 in Shepparton, 566 in Mitchell, and 356 in Moira Shire, and 81 in Strathbogie. We have 17 patients in our at GV Health who are admitted with COVID-19 at the moment. One of those is in intensive care and on a ventilator. We're still around about 80 to 85 staff that are furloughed at the moment, and continuing to operate, of course, under the pandemic code brown circumstances. Although pleasingly the case numbers are starting to reduce overall, we have seen a little bit of an uplift in the last 2 or 3 days in relation to the school surveillance program being a big driver in terms of what's led to that little uptick in terms of case numbers. We expect that'll probably flatten out in the coming few days, but the impact on our operations is still fairly significant in terms of the number of staff that are furloughed, plus our underlying recruitment vacancies and challenges that we have. As I've previously mentioned, we have around about 50% of our doctors in terms of positions that we're unable to fill, so about 60 full-time equivalent doctors that we're unable to recruit at the moment, as indeed we've got a number of people across 40 to 45 full-time positions in our medical and surgical nursing teams, and about 40 to 45 in our mental health teams. So we're working really hard to close that gap. We've got a bit of a challenge too in terms of operating in the pandemic circumstances that we are at the moment. So happy to pause there and take some questions, but please, if you haven't had those third dose vaccinations for people who have already had their second dose, those aged 18 or over, or if you've got a child 5 to 11 who hasn't had their first dose, please get that booking made or walk up for the vaccination as soon as you can. Thanks.
Was it pleasing to see the TGA approve those booster shots for those teenagers coming in now?
Absolutely. I think it's really terrific. So that if we can sort of get the first dose into primary school age children or thereabouts and start to progressively move down the older age secondary school children, I think it'd be nice that we can join them up in the not too distant future. And so anything we can do to increase the immunity in the community is fantastic.
Jerome Weimer said today that he thinks that hospitalisations in Victoria have peaked. Do you think the same could be said for Golden Valley Health?
I think they've probably peaked, but they're not declining for us. They're more plateauing. I don't think statewide I've seen those numbers, and absolutely they've peaked and they're starting to go down. But that's not our experience locally. Where, as I said before, 17 patients today. We've been around about that mark, 17, 18, as much as 20 in recent weeks. So we've come down a little bit, but I think we'll continue to see, for us at GV Health, admissions in that 15 to 20 range every day. And as I've also mentioned previously, the people who, what's different with the Omicron variant as opposed to Delta and previous outbreaks is the primary reason people were coming to hospital when they had COVID was for COVID related symptoms or because they had respiratory illness or they were really feeling quite unwell. What we're seeing at the moment is a small number, 25 to 30% in that range of people are admitted for reasons where COVID isn't the primary diagnosis of why they're here. They might have broken their leg or needed some abdominal surgery or something like that, but they've got COVID. So with so many cases now in the community and the Omicron variant being so contagious, I think it's likely we'll continue to see that. People coming in perhaps not even knowing that they've got COVID too. That's happened a few times where we've tested people and they've been positive and they didn't expect that they would be positive. So it's going to continue to be the case for a number of weeks, if not months, I think, that we'll be having to deal with these sorts of circumstances.
You mentioned about the school surveillance program. Are you expecting to see more positives come out of that? We know schools have been an issue in the past, or is it just because they're coming back from holidays that there's been so many?
I think it's probably going to be more cases during the course of this week and perhaps into next week. But there's other environments too. I think the school surveillance program's a terrific idea, but there'll be other environments where there'll be kids mixing at weekend sport and things like that, where they'll be moving between, that they're not in their school group, they'll be in their sport group. So it's more than likely we'll continue to see the numbers be pretty consistent in the school surveillance testing program in coming weeks as well.
Do you have any idea how long the program will continue at GV Health? Like, is there a possibility of hospitalisations drop in Melbourne that it'll continue here?
So the Department of Health have declared the code brown as statewide for all metropolitan health services and also the regional health services, which GV Health is one. There's a couple of smaller health services across the state that have also enacted code brown. So with the code brown, it's unusual for a statewide code brown to be called. And when that happened, the Department of Health certainly said that it would be a 4 to 6 week period, which would have taken us through, say, to the 3rd or 4th week of February. But individual hospitals can call code browns at any time, depending on what's happening in their local circumstances. So in answer to your question, it's something the Department of Health will make a judgment on, in my view, when they feel that it's at the right point to stand down the statewide code brown. But as I said, individual hospitals will have their own discretion to either continue operating under a code brown or to stand it down at that same time.
Have you heard when we might see elective surgery return?
Only, I know in some of the meetings I've been in, it's being discussed at the moment. For us at GV Health, it would be based on our workforce challenges just at the moment. It would be a challenge to quickly ramp back up into Category 2 and Category 3 elective surgery. But we'll do everything that we can to be able to treat as many patients as quickly as possible. The other thing that's worked really effectively in the past and continues to do at the moment is that Shepparton Private Hospital and a number of other health services in our region have been really supportive in having patients that are on our elective surgery waiting list treated at those hospitals. That partnership arrangement will continue into the coming weeks and months as well, so that we can treat as many people as possible that have had to wait for longer periods of time for their elective surgery.
Great. Thank you.
Thanks.
Oh, that wind's nice.